It's time now for Countywide, a special presentation of Yavapai Broadcasting News. Join News Director Paul David and News Editor Philip Catafamo as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics in Yavapai County that affect all our lives. And now here's today's Countywide.
Welcome to Countywide. I'm Paul David. As always, it's great to have you in studio with us today. We're sitting down with Yavapai County Health Department Director Leslie Horton. Welcome back.
Thank you, Paul. Nice to be here.
First time to be here in 2022 with us today.
That is right.
So I brought you in because Omicron cases, COVID cases, we were doing really well. And I think we all thought there was a light at the end of this tunnel. And there is still a light at the end of the tunnel somewhere. The tunnel is just a little bit longer than it was. And the cases just started going up and up and up. I noticed the state's having 20,000 plus cases a day, and I think about that to myself, and I think, okay, that's like that's like all of Cottonwood and all of Camp Verde infected in one day. And it's been like that for the last 3 weeks now. So can we get kind of an update on you on how things are going? Let's focus on our little part of the world, Yavapai County, and how things are going in Yavapai County.
Yeah, and you're exactly right. I think that we're seeing nationwide, obviously, a surge in cases, and even worldwide. This Omicron variant that's coming through is maybe not as severe as the other variants, but it is sweeping through our populations. And so what we're seeing here locally is before Christmas, we were seeing mostly Delta variant. And we were having a high level of cases since Thanksgiving. They were filling the hospitals. We were seeing this surge in cases. But then we saw those numbers kind of start dwindling right before Christmas. It was coming down to almost 100 cases a day. And now since Christmas, we have also seen through sequencing of tests and those kind of things that now Omicron variant has taken over, and it is pretty much wiping through, it seems. We're having over 300 cases a day, which is higher than the surge I think that we saw last year. We had a pretty good surge after Christmas last year, but 300 a day, we've had 4,000 cases in our county alone since the beginning of January. Mm-hmm. And so, the good news is we are seeing fewer hospitalizations than we were seeing prior to Christmas, which is good news. That shows that Omicron may not be making people as sick, but a lot of people are sure getting sick right now.
Well, the hospitals are staying. I feel like I see the weekly update that Carol sends us, and it'll show that Yavapai Regional Medical has 50 plus cases, and Verde Valley Medical Center has this many patients, and then the VA in Prescott has this many patients. And the next week, I'll see that we get like 40, 50 deaths in Yavapai County, and I feel like, wow, are these all people that were hospitalized? Are these people that weren't hospitalized, and we've got those numbers? Are we basically the people going to the hospital dying, and then we're just refilling those beds again? I mean, how is that working out there in that case?
It's a combination, and
okay.
I spoke with our medical examiner yesterday, and some of the cases he doesn't see. Right now we're seeing 4 deaths a day on average since the beginning of the year. Prior to Christmas, we were seeing about 5 deaths per day, which is a lot for Yavapai County. These are folks that some of them may have been sick already, but some of them not. And one thing we know about COVID is that even if you had underlying health conditions, it's causing people to die much sooner than they otherwise would have passed away. And so with that, the medical examiner said they're finding more and more people that are refusing to go to the hospital, and they die at home. And so those cases do come through the medical examiner's office. The others that are being treated in the hospital, there is still a high level of death amongst those in our county. And we have a high senior population, which makes our death rate just a little bit above some of the other areas in Arizona. But it is concerning. And sometimes they either get to the hospital too late or seek treatment too late for it, or had underlying health conditions that otherwise got worse when they got COVID.
I've heard reports that people are actually going out and trying to get the Omicron variant because they feel like they've heard that, like you said, it's more of a head cold. And so they're like, well, I'm going to go get Omicron as many times as I can, so I'll just build up this natural immunity to it. Is that such a good idea?
I don't believe it's a good idea unless someone is absolutely, I shouldn't say unless. It's not a good idea. Okay. You never know how COVID's going to react in your body. So you might be a healthy individual that ends up having long-term health effects. And we've also seen healthy individuals die from COVID in those experiments where they decide that they want to get it and get over with it and build immunity or whatever they're trying to do. But the other thing is, unless that person is willing to absolutely quarantine and isolate themselves after that exposure, what happens a lot of times is folks have that exposure, maybe knowingly at times, and then they're out possibly infecting others in those days just prior to when they come down with the sickness. And that puts a lot more people at risk for getting sick, and especially those who cannot maybe handle having COVID in their system.
Okay. Back to the hospitals. How are they doing? The staff and the hospitals, I mean, you talk to them probably on a regular basis, I would imagine, right?
I do.
Yeah, I mean, is everybody doing all right? Because you and I were talking about just before we started that, there's a thing called COVID fatigue. We're all a little COVID fatigued, but I feel like I got to keep reporting it because it is out there and it's part of our world today and people need to know what's going on with it. But how are the hospitals doing, staff-wise, materials, all that stuff?
We are seeing that COVID fatigue across the board. I think that especially in healthcare and public health and all of these areas where our focus has had to be so entrenched in COVID-19 now for over 2 years, it's a lot to deal with. And in the hospital setting where they have just been overwhelmed with cases from time to time, it's not been consistent, but leading right into the holidays here, we have had a healthcare shortage. And so that's a nationwide issue. It's definitely a local issue as well. And people that have been dealing with COVID and on the front lines of COVID, they're tired. And you get to that point where another career path sounds really good, or maybe working from home, or an option where you're not dealing with such intensive care of COVID patients. And so the hospitals are doing quite well considering, but they have seen staffing shortages in all of our local hospitals, and they're just trying to keep up with those surges as they come. So they've done a good job of clearing space, making sure that they amp up their operations when we know that there's a surge coming. Usually those surges follow about 2 to 3 weeks after we see a surge in cases. So we'll see those new cases start to rise. Then about 2 to 3 weeks later, we see the hospitalizations start to rise.
Yeah.
And so they've done a great job. I do know that everyone at this point is ready to deal with other things and go back to some sense of normalcy, but we're not there yet.
Yeah, I don't get any reports from them saying that they're short-staffed or anything else. Northern Arizona Healthcare sends out something every now and again, but for the most part, I don't hear much from the hospitals. How are the nursing homes doing in Yavapai County?
The nursing homes are doing quite well, and early on in COVID they were struggling at times with their infection control, and this was new and different, something they'd never really dealt with before, way more severe than a flu season for them. And so at this point we're seeing far fewer outbreaks. Part of that is because of vaccinations, and we made a priority to get into those assisted living and skilled nursing homes with vaccinations. When they do see outbreaks now, they're usually getting them under control rather quickly. And so we've had a few within this last surge of COVID. So since Thanksgiving, we've had a few minor outbreaks, but not nearly as severe as we were seeing during those initial surges of COVID.
Okay, all right, let's take our first break. Yavapai County Health Department Director Leslie Horton in studio with us today. YavapaiAZ.gov is the website for the county. We'll be back in just a couple minutes.
Terrifying jobs. Bull Rider, take 2.
Cliff, this seems like a really terrifying job. Why do you do it?
I love protecting the bull riders when they get bucked up.
How big are these bulls?
12 to 2,200 pounds of pure muscle.
You're not cowed by any of this, obviously. Is there anything that scares you?
Yeah, distracted drivers terrify me.
Two things we can count on every year:
a new set of tax rules and great weather here in northern Arizona.
Jackson Hewitt Tax Service, locally owned and operated by Lewis Rice since 1997, is here for you all year long.
Your neighborhood Jackson Hewitt Tax Office will help you in all of your taxing situations.
Electronic filing is always free with your tax preparation at Jackson Hewitt Tax Service.
Get more in return. Call 1-800-234-1040 for an office near you.
The EPA says C&B Construction ranks in the top 1% nationally. C&B Construction invites you to see what energy efficiency and indoor air quality can be. We have won another Department of Energy Innovation Award, and C&B Construction is the only contractor in the country to win 6 consecutive EPA Indoor Air Plus awards. Experience our zero-energy, move-in-ready homes at Crossroads at Mingus.
C&B Construction, locally respected, nationally recognized. Find out more at C&B Homes.com.
Award-winning Soundbites Grill is an entertainment restaurant located in Uptown Sedona at the Hyatt Pinion Point Resort. Open for lunch and dinner, featuring fresh fish, all-natural hand-cut beef, even a full vegan menu. Family-friendly, open 11:30 to 9, late dining on Friday and Saturday. Soundbites Grill has some of the best views of the Sedona Red Rocks. Offers world-class entertainment, food, fun, and music.
Welcome back to Countywide. I'm Paul David. Yavapai County Health Department Director Leslie Horton with us today. YavaPaiAZ.gov is the website to get to all county information in Yavapai County. We're talking COVID-19 and just getting an update from you because we had COVID-19 and then we had the Delta variant, which we saw some spikes on that. But this Omicron, bigger spikes than we've ever seen before on this one, but it's not as severe. Is it safe to say that?
In some, yeah. And like I had mentioned, that it's not as severe. We're not seeing as high a hospitalization rate due to it. They say it's more like a head cold. It's not going down into people's lungs as often. It still can. The symptoms are just a little different than the previous variants that we were seeing, and for most, not as severe.
Well, Leslie, how come it's Omicron now? How come I never hear about people with Delta or the original COVID-19 strain? Did those just go away? I'm getting that question.
Yeah, you know, it actually kind of does. And what happens is these new variants take over quickly. So we do watch the sequencing of tests. TGen North is a lab that does sequencing for northern Arizona. And so a lot of the tests that are done in the Verde Valley are sent off to this TGen North. And what they were seeing prior to Christmas is that most of the cases were still Delta. And now since Christmas, and even across the state of Arizona, there's been this Omicron variant that's just taken over. And so you rarely see Delta anymore. Now it's this new variant, and that tends to be what happens. I really don't fully understand why, but the new variants do find a way to just sweep through and take over.
Okay. I'm curious now also, so we did hit COVID-19 was the original strain that we were talking about very at the beginning, and then we started talking about Delta, and then Omicron raised its head in South Africa, and we watched it there, and we saw it go up in South Africa, and then of course once I heard it was in South Africa, I said, okay, it's all over the planet now.
Yes.
It's just a matter of time before we have it everywhere.
Yes.
So Delta became Omicron. Is Delta still out? Well, okay, so Omicron kind of took over Delta and said, okay, Delta, we don't need you anymore. We're going to be Omicron now. Right. Does that simplify it too much?
I think that's about how it works. And you see it at different rates throughout the nation, but Omicron has been so contagious that it just has kind of swept through and taken over as the main strain.
Have you guys talked about now, can Omicron, of course, since we've seen that the more it gets a chance to jump between people, that's the more chance it has of changing and altering its effect on people. And what am I going to be this time? What am I be next time? Omicron is the way the dice rolled, it's Omicron. Now it can change again and become something different. Now, I've heard people say, well, as it changes, it's just going to keep getting weaker and weaker and weaker. Is that the case, or could we kind of see it kind of turn and go the other direction again?
Well, I sure hope that's the case.
Right,
but we don't know. And so Delta seemed to be even a little bit more severe possibly for hospitalization than the strains that we saw prior. Omicron, it's it's been a relief to see it a little less severe, still very severe for some. And you hope that with these, and especially as more and more people have either vaccine produced immunity or natural immunity from having had previous strains of the virus, that it does become lesser and it impacts their immune system lesser and their overall illness is lesser. But it's still to be seen. And the next variant could be stronger. It depends on how it mutates and what symptoms it causes. But it's my hope, and I'm sure the hope of a lot of folks, that we'll continue to see these variant strains become lesser severe like this one is.
But I would say that we're probably expecting another variant to come on down the line. aren't we?
Absolutely.
Yeah.
I think, especially as it spreads to more and more people. I mean, we saw worldwide a 20% increase in overall COVID just this week. And so with that, with more and more people getting it, it manifests differently in everyone's body, and all of a sudden, somebody gets it and they have maybe some different health conditions that cause it to mutate in a different way, and if they pass it on, there's a variant. And so it's, you just never know when the next one's coming. I hope it takes a little while. This one, though, is surging through, and like I said, 300 cases a day in our county, it'll add up quick. And there's a lot of rumor and theory that this one might sweep through and just about everyone might catch this one. And that would give people a level of immunity if they don't have it through vaccine or other means, but it also can be dangerous for some, and so it's a double-edged sword. You want to build up that immunity in the population, but you also don't want to see the hospitalizations rising and people getting really, really sick.
Yeah, and the more it has a chance to, because this one is a fast spreader too. This one's super contagious compared to the last couple, so this one's a fast spreader, but it maybe has less symptoms. But then again, with it being a fast spreader and jumping just into about everybody, that gives it that much more opportunity to possibly change who it's going to be.
Absolutely.
And then we'll be saying, okay, here's the next variant that we've got coming along. And then it's going to be, okay, is Janssen & Janssen, is Moderna, is Pfizer, are these vaccines effective against this? If we get one that they're not effective at all against, I feel like that's going to put us right back to the very beginning of COVID, which would be a pretty scary thing to have happen.
It could, except that we are building up over time this level of immunity in the population. So like we saw with Omicron, a lot of people that are vaccinated are still catching it, but it's a far lesser strain, and it's not just the strain is far lesser, but if someone's vaccinated or had previous COVID infection, it's generally a light cold. Now, some people have had it more severe the second time. Some people are starting to get COVID for the third time. And so, it just, as it passes through, we're all building up this level of immunity, whether through exposure, vaccination, or active infection. And so over time, you just hope that it doesn't mutate so much that we see a very, very severe strain come through. And, I think with this one sweeping through as quickly as it is, most people will have some level of immunity here in the next few months.
There's been some reports recently that I think it was South Africa saw their cases spike and then come back down really fast.
Yeah.
I heard that the East Coast is also seeing some of that too, where it's kind of spiked, leveled out, and it's starting to come back down.
Yeah.
So I feel like we are maybe hopefully getting to the top of that roller coaster ride, and we're just going to start coming down on the other side. I hope that's
so.
the case.
Yeah, I really do hope so, and that's what they have seen. And I think in South Africa, they said almost 80% of the population they thought had it at one point or another within that spike. And so, therefore, it can't go anywhere, and it has to come back down. And so we'll hope that we start seeing that decrease here shortly.
Real quick, we got a minute before we take another break. How are you and your staff doing? How's the county health department doing with this? The medical exam. We mentioned the medical examiner's office. Yeah. They're holding up as well.
Yeah, I have an amazing team, and they have been so dedicated to this work. And we've had very little turnover during this time. Now, when I look around at everybody and talk to them,
knocked on wood. Yeah.
They're tired. Yeah. And it's been a long haul, and I'm trying to encourage vacations and other things to try to reinvigorate, but then we hit these surges in COVID, and we really can't take much time off. And so it's been a long haul of a lot of work. And our medical examiner, his staff are doing well, but they are also very tired. They've had a lot to deal with over the last 2 years, and have had times of overwhelm and times where they've been short-staffed, and it's just it's taken its toll on everyone. But I've been very thankful that we've had very low turnover. Everyone's really stuck with it, and they're dedicated. Whereas, when I look at other public health departments across the state and the nation, they've had a lot of turnover, and we've been very, very fortunate in that way.
Awesome. Okay, let's take our second break. Yavapai County Health Department Director Leslie Horton with me today in studio. YavapaiAZ.gov is the website. Stick around. Countywide back in just a couple minutes.
Terrifying jobs. Bull rider, take 2.
Cliff, this seems like a really terrifying job. Why do you do it?
I love protecting the bull riders when they get bucked off.
How big are these bulls?
12 to 2,200 pounds of pure muscle.
You're not cowed by any of this, obviously. Is there anything that scares you?
Yeah, distracted drivers terrify me.
Two things we can count on every year:
a new set of tax rules and great weather here in northern Arizona.
Jackson Hewitt Tax Service, locally owned and operated by Lewis Rice since 1997, is here for you all year long.
Your neighborhood Jackson Hewitt Tax Office will help you in all of your taxing situations.
Electronic filing is always free with your tax preparation at Jackson Hewitt Tax Service.
Get more in return. Call 1-800-234-1040 for an office near you.
The EPA says C&B Construction ranks in the top 1% nationally. C&B Construction invites you to see what energy efficiency and indoor air quality can be. We have won another Department of Energy Innovation Award, and C&B Construction is the only contractor in the country to win 6 consecutive EPA Indoor Air Plus awards. Experience our zero-energy, move-in ready homes at Crossroads at Mingus.
C&B Construction, locally respected, nationally recognized. Find out more at C&B Homes.com.
Award-winning Soundbites Grill is an entertainment restaurant located in uptown Sedona at the Hyatt Pinion Point Resort. Open for lunch and dinner, featuring fresh fish, all-natural hand-cut beef, even a full vegan menu. Family-friendly, open 11:30 to 9, late dining on Friday and Saturday. Soundbites Grill has some of the best views of the Sedona Red Rocks. Offers world-class entertainment, food, fun, and music.
Welcome back to Countywide. We've got just a few minutes left in the program. You've heard on our newscast, we've talked about the testing locations.
Yep.
There was a changeover in the Prescott Valley area. It was not at Glassford Hill Middle anymore. It was at Humboldt Unified, was doing some testing there. Cottonwood Fire Department in Cottonwood has testing Tuesdays and Thursdays for a couple hours on those days. Check with the Cottonwood Fire Department. That's through the end of January.
Right.
But we've got 2 more. There's one that opened in Cottonwood, and there's one that's coming in Camp Verde as well.
Yep.
They're both open, so those are going.
We're adding locations all the time, so I recommend that people look at our website
Check back.
yavapaiaz.us/CHS, and we've contracted with one of the state contracted testing sites, because tests have been a little bit difficult to acquire lately, but we contracted with this lab that'll come up and set up pretty much anywhere that we need them to, and as long as we have an allowed location. And so that's been helpful. So the fire departments, we really appreciate that they've stepped up and have been helping us out. And other healthcare providers and others are all trying to do their part. It's just been, a lot. There's so many cases right now and so many people sick with not just COVID. They're getting tested when they have other things too to figure out if it's COVID, which is important to find out if they've got it. But we want them to get tested, and we want them to have easy and low cost or free locations to do that.
Yeah, so keep checking the website, because as we were talking before the show, I was in Walgreens and they had no tests the day I was there.
Yeah.
They were all out, and my wife has been trying to get some of those at-home tests, and they're out too. So it's a challenge right now. So I guess we're all doing the best we can at the moment.
Yeah, we are.
One more question, 1 more minute. Endemic. That's the word we're looking for somebody to finally say to us. We're at the endemic. Are we going to get there?
I hear different things. I hear that we'll be there within years. Some people think that Omicron's the one that's going to get us there. That just means that enough of the population has a level of immunity where this becomes more like a common cold, like the flu. We may have to deal with this on a regular rolling basis like we have. We see a surge in July, a surge in the holidays, pretty much. And yet, we do hope that level of immunity rises to the point where it's not so severe for everyone. It's more like the cold or the flu, and we can handle it more like we've historically handled the cold and flu. So we will keep hoping. I hope sooner rather than later for all of our sake.
So do I. Normalcy would be nice, but it's going to be, it's going to be a little while longer. All right. I think that.
All right.
That does it. If I go to your website, I'm going to find the information I need about COVID-19, Delta, Omicron. COVID information is going to be there, so that's where you need to go to look for that information. All right.
Yep. Anything people need to know, just go to that website, and we try to post updates. Anything that's happening that we know of, we'll post it there.
Yeah. All right. Thanks for coming in today.
Absolutely.
We'll have you back, and hopefully we don't have another variant. I don't have to have you back.
Maybe we'll be talking about something else.
I would love to. Oh, wow. That would be unique, wouldn't it? All right. So that's today's Countywide. As always, we thank you so much for watching and listening. We'll talk to you again next time.